shoulder.
Before that,
Check
Assess the
yes,
situation.
all right, and I'm gonna stop. All right, I'm gonna stop and I'm gonna check the scene. I'm gonna look for things because I didn't see what happened. So I'm gonna be wondering. I wonder what happened here. Is there any broken pieces of glass? Any sharp objects? That would indicate that there could be a wound that I have to deal with. Is there any water? Is there any electricity? Is it safe to approach? All right. So I'm going to be checking that first, and then what should I do? I need to protect myself, don't I? All right. I happen to have some gloves in my pocket, so I'm going to put my gloves on. Now, Tina, you're going to pretend to be unconscious. You can keep your eyes open if you like. I'm going to talk to you, but you're not allowed to answer me. All right? Okay. All right. So now I feel like, all right, I've stopped. I've assessed the situation. I feel like it's safe for me to approach. I've got protection. So now I'm going to approach my casualty. And now I want to tap her on the shoulder and see if she is responsive. Because I don't know if this is normal for Tina just to lie on the floor like this? She might just be like that. So I'm just going to check to see if she's responsive. So I'm going to do that by tapping her on the shoulder, and I'm going to give her a little shake as well. Hey Tina, can you hear me? All right, so you're not allowed to talk to me. All right. Can you hear me? No response. All right, she's not responsive. All right. So now I've determined she's not responsive. This is not a normal situation, and I'm going to need some help. All right, I want to call 999. So this is my time. I'm going to shout for help. Help! Somebody help! All right, and while I'm waiting for somebody to come, I'm going to check to see if she's breathing normally. First of all, I'm going to open up her airway. Now, she's wearing glasses, so I want to remove her glasses at this stage. I'm going to put them somewhere safe. And then I'm going to open up her airway by doing the head tilt chin lift. So I'm going to have one hand on her forehead, two fingers on the bony part. Not here, because she'll be blocking off the airway, but here. So I can feel the bony part of her chin. I'm going to push down and pull up. Do you see that difference?
Yes.
That's a big difference, isn't it? Can we go back and do that again? So one hand on the forehead, two fingers here, push down, pull up. All right, so it's a head tilt, chin lift. Now, I'm going to look and feel for normal breathing. How long for? Do you remember? 10 seconds. Okay, so I'm looking to the chest to see if I can see it rising and falling. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. Excellent. She's breathing. Hallelujah. Okay. So now, maybe somebody's responded to my call for help. So then I want to nominate them to do some jobs. Could you please call 999? Could you tell me we've got an unconscious patient but they're breathing, all right? Can you go downstairs and meet the ambulance and bring them back here? Can you grab the first aid kit? All right, you could just tell people, give them jobs to do, all right? If nobody comes, now's the time. Put your phone on speaker mode and call 999 whilst you're carrying on with your care of the patient. All right? Okay, so that is our primary survey. Okay, so what we're going to do, thank you so much, Tina. What you're going to do is if Tina vomited and she was in this position, what would happen?
Will choke.
Yes, she could choke on her vomit. So it's very important to turn it over onto her side. Also, she might accumulate some saliva in her mouth as well. If you put it over on the side, it's going to drain out, all right? And also, to keep her airway in an open position, it's much easier to keep it that way over on the side. So we need to keep it open. Remember that tongue tends to flop towards the back of the throat and it could block off the airway. So we're going to put her in recovery position. So I'm going to show you right from the beginning again of me coming across my casualty and how I'm going to approach. All right. So Tina, you're not going to talk to me and you're just going to let your body go floppy. All right. Oh my gosh, Tina, I wonder what's happened. All right, I'm going to stop, check my scene. Is it safe? All right, get my gloves on. Oh my God, I don't see any water there or any sharp objects. I think it's okay. All right, I'm going to go and see. Oh my gosh, Tina. Hello, Tina, can you hear me? Can you hear me? Are you all right? Are you all right? Oh, there's no response. Okay. Help, somebody help. Okay. All right, just check that you're breathing. Okay, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000. So I'm just going to have a feel down her arms, everything okay. Look at her abdomen, feel underneath, like that, okay. Nothing, that's all right. Just have a feel, no broken bones. Doesn't seem to be, no wounds. All right, okay, she's good. So I don't want to leave her in this position. We've determined if she vomited, she could choke, right? We're going to turn her over onto her side in what we call the recovery position. So you always want to turn the casualty towards you. You never want to turn them away from you because you have no control over the turn, okay? So I'm going to turn Tina towards me. So I'm going to take the hand closest to me and we're going to put it at right angles to the body. We call it the Hello Kitty Lucky Cat. All right, Hello Kitty Lucky Cat, closest to me. The opposite hand, we're going to take it and we're going to put the outside of the hand to the opposite cheek and then I'm going to hold it in place. That's our praying hand. So Hello Kitty, praying hand. All right, I'm going to hold it there because she's unconscious, she's floppy. If I don't hold it, it's just going to fall down, all right? So I'm going to hold it in place here. The opposite leg, I'm going to lift up like that, all right? And then I'm just going to pull on the knee. Just going to make sure she doesn't have anything in her pockets either. If it was a man, they usually keep wallets and keys and everything in their pockets. And then the keys could dig in and it could cause an injury. So just pull on the knee and turn her on the side. All right, Tina, I'm just going to turn you over onto your side, honey. All right, and you see how easy she comes across. Super, super easy. It's not hard. It doesn't hurt my back at all. So you could do this with quite a heavy casualty. If it's really heavy casualty and you feel that you can't turn without injuring yourself, then try and go and get some help and get somebody to help you turn, okay? So now I'm going to have a look at the back. The back is exposed. Is there any wounds there? And I'm going to open up her airway. I'm opening up her airway by doing that head tilt chin lift. And now I'm going to do a final check and say to myself, could she still choke in this position? And I think she could. All right, I've turned on her side, but her head is still kind of facing upwards. So what I'm going to do is I'm just going to pull on the shoulder like that, brings her over, open up that airway again. Okay, I might want to loosen the mask. Have a look. Is there any fluids on the mask? Is it okay? It's fine. I'm going to put the mask back on. But you're going to have to keep on monitoring and checking because, of course, if she vomits, I'm going to have to take the mask off. I might have to even go into her mouth and scoop it out, right? So you need to keep an eye on that. And I want to stay with her and make sure that she is breathing, right? Very, very important. Just make sure that my scene is safe, that her airway is open, that she is breathing normally. Now, to check breathing in this position, I can put my hand on her abdomen again, and I'm going to be looking at her chest. Is it rising, falling? I can feel when I put my hand on the abdomen, it's moving in and out. You need to make sure that it is normal breathing, all right? And I'm going to keep on monitoring her until the ambulance comes to take over the care, okay? Now, if it was somebody that I suspected of a spinal injury, I don't want to turn them. But I would have to be absolutely certain that they are breathing normally before I left them in the position I found them in. If that person, maybe that you did find them at the bottom of the flight stairs, so you're thinking, oh my gosh, I think they've fallen, so they've got a spinal injury. But if they're not breathing normally, you're going to have to turn them and start CPR because they're going to die anyway. You might cause more damage, but they're going to die, so you have to do that, all right? Tina, you've been wonderful. Thank you so much. Did you go to sleep? All right. lungs. If I don't pinch the nose, it's just going to come straight out again. All right, so we need the air to go into the lungs. And then I'm going to make a nice tight seal with my mouth around the mask here, around the mouth, and I'm going to do 5 normal breaths. 1, 2, 3. Do you see that I'm looking to the chest?
Yes.
I'm looking to see if it's rising and falling, right? Because maybe, I didn't witness it, it could possibly be a choking incident. If you don't get rise and fall of the chest, reposition the airway first of all, because if the airway is not open properly, do you see? It's not going to go in. You open up the airway, and then it goes into the lungs. So you do that first. If that doesn't work, you have a look in the mouth. Can you see anything there? If you can see it, and it's loose, all right, turn them on the side. It should fall into the cheek, and then you can hook it out. Never go blindly sweeping around because you could push it further down, all right? So, I don't see anything, right? I've done 5 initial breaths and they didn't respond. They didn't stop breathing again, right? So, I'm going to do 30 chest compressions, but this time I'm just going to use one hand because they're going to be smaller, all right? Their lungs are smaller. And then the sternum, their bones are still developing, right? In an older person, the bones are really hard and brittle. But with a child, they're kind of bendy. So it's actually a little bit easier to get the depth you need. And you'll be looking at pressing down about 1/3 of the depth, which is approximately 5 centimeters on the child. So you can keep the airway open with one hand, center of the chest, heel of the hand, kneel, and then you're going to do 30. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Back up. Now you're going to do 2 rescue breaths. Center of the chest. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. All right, that's about card. So it would probably be down at the reception or with the security guard. They're usually kept with the security guards. All of the schools here, pretty much all of the schools here have AED machines, right? Have you seen any signs for AED machines at the schools?
Yep.
There is a heart in the AED.
Yes, exactly. There is a heart and it has like a lightning flash through the heart, okay? And they are located usually at the front entrance of the school by the reception. So next time, if you're taking kids to school, take a look and see if you can see the sign for an AED. It's okay? You need?
Bye.
That's all right, that's okay. All right, so, yeah, take a look. They're in a lot of the clubhouses here, by the swimming pools as well. Have a look and see if you can find out where there is AED machines. Normally, people don't even notice that they're there.
Yeah.
In the UK and in America and a lot of places in Europe, they are everywhere. They are in shopping malls as well. In the UK, they've converted telephone boxes into places to keep AED machines. They're very good. And they are a life-saving piece of equipment. So, when somebody has collapsed, hopefully there's some people doing CPR, they've told you to go and get the AED machine. You bring the AED machine and you come back and you put it by the person's head. You don't want to put it here or here. You don't want to put it here because hopefully there will be two people doing CPR and they'll be switching over. If you put it by the legs, the leads are not going to reach up to the chest, okay? And then this is a trainer, so I have to program it, but you just turn it on as soon as you bring it. So you turn the machine on, and it should start talking to you.
Call for help now.
Oh yeah, forgot to call 999, all right? So it reminds you to call for help. Remove all clothing from patient's chest. The pads have to go on the bare chest, so you have to remove the clothing. And the best way to do that is with scissors. You don't want to start trying undressing somebody because it's like undressing someone that's drugged too much, okay? It's very hard and very time consuming. With every AED, there should come a packet with some scissors and a cloth and a razor. So you take the scissors, and even if it's a lady wearing a very beautiful Chanel dress, you've got to cut through it, okay? So you cut through it, and you expose the chest. If that person has a hairy chest, if it's a guy with a hairy chest, you're going to have to shave where the pads go, because otherwise the pads are not going to stick, all right? So the pads are going to go here. You can have a look. Where are the pads going to go? Okay, here and here. So you're going to just shave, all right? And you're just going to do it quickly. Just get the worst off so that it will stick. If you've had to drag them from the swimming pool, or it's hot in Hongkong in the summer, maybe they're sweating, all right, and their chest is wet, there will be either some tissues or a cloth. You need to just wipe it. It doesn't matter if there is a little bit of water there, or if it's by the side of the swimming pool, or if it's on the beach, or if it's on a wet playing field, or even if it's in a puddle. You can still use this machine, all right? Don't waste time trying to pull this person to dry ground because they're going to be a dead weight, literally, all right? It will be very hard. All right, she's just going to keep talking to me till I do what she says. If it's a lady with the bra on, you just push it up, or you can cut through it. Doesn't matter if it's got the wires underneath, you just push it up or cut through it, okay? So, you take the pads and you follow the picture.
Okay.
Check connector.
So you see, it tells me where they go. So this one is going to go here,
Supply pad to
like that.
Exactly as shown.
And this one's going to go on the side here,
Heal other pads
like that. Okay?
Supply pad.
The goal here is you don't put them on in lumps, bumps, or scars, alright? You don't put them on lumps, bumps, and scars. Now, I have to program this, okay?
Do not touch patient.
Don't touch patient, everybody stand clear, don't touch the patient. Evaluating the rhythm, don't touch.
Stand by. Preparing to shock. Everyone clear.
Everybody clear, don't touch, everybody clear. somebody would have been doing chest compressions whilst you were opening up the AED, getting it all sorted. So they just keep going. They keep going while you take the pads on. You put one pad on, and then they can carry on, and then you're peeling that, and you're putting another pad on. All right. This is what's happening to the heart. When somebody goes into cardiac arrest, the heart doesn't go completely flatline. What actually happens, it goes into this abnormal rhythm called ventricular fibrillation, or VF for short. And it's like, if you can imagine a jelly going wibble, wobble, wibble, wobble, like this, that's what the heart's doing. It's this abnormal, crazy rhythm. So by shocking the heart, what you're trying to do is put it back into that normal sinus rhythm, all right? But you only have about 10 minutes to do that. The heart only stays in that rhythm for about 10 minutes. And every minute that it doesn't get a shock to the heart, they lose 10% chance of surviving. So after 5 minutes with no AED, there's only 50% chance that that person's going to recover. After 8 minutes, there's only 20% chance that they're going to recover. And after 10 minutes, chances are they won't make it. How long is that ambulance going to take? 12 minutes, they say. All right? It could be 5. Could be 30. You don't know. All right? So that's why it's really important, if there is an AED available, you get it and you can start it immediately. There's a lot of ignorance in Hong Kong sometimes by the security guards. They might say, oh, you don't need it, it's okay, we've called for an ambulance already, the ambulance is coming. No, you absolutely do need it, because every minute that person's losing 10% chance of surviving. So, you need to put it on as soon as possible. And this will not shock the patient unless they need a shock. It's very good. You know when we stopped, it was analysing the heart rhythm? Oh, 2 minutes is up. Don't touch the patient.
Evaluating heart rhythm.
It's evaluating the heart rhythm.
No shock advised.
Oh, no shock.
Provide chest compression
Okay.
and rescue breath.
You do whatever the machine tells you to do. All right? Whatever it tells you to do, it's a very smart piece of equipment. It's like a computer, right? So what it's doing, once you've got the pads on, it will know you've got the pads on. Sometimes you have to put the connector in.
Continue care.
Like that, okay? They're all a little bit different. But what it will do is, it will then say, evaluating the heart rhythm. So that's why you don't want anybody touching the patient when it's evaluating the heart rhythm, because if somebody's touching them, it's going to get their heart rhythm. So if I was touching, it would pick up that I was, had a normal heart rhythm, and then it wouldn't give a shock. So that's why it's really important that nobody is touching when it's evaluating the heart rhythm. And then if it says, okay, we're going to give a shock, nobody's touching, otherwise they're going to get a shock as well. It's not going to kill them, but it would give them quite a jolt. So you need to make sure that nobody is touching. So I'm going to turn it off now. So they are a very, very good piece of equipment. These pads are interchangeable. So if you put them the wrong way around, say you put that pad here and this pad here, it's fine. Just leave them in place. If you try to take them off and re-stick them, they probably won't re-stick, okay? Because they'll take the body oils and hair with them. It'll be like a waxing treatment for a guy, and then they won't stick again. So these have a shelf life of about 2 years, and then they expire. What happens, the gel on them gets really hard, and then they don't stick properly, and then it doesn't conduct electricity. So whatever you do, so you're just crossing a little bit, okay? Somebody's told a funny story when you were eating. Oh, Tina! Oh, gosh, are you okay? Just keep coughing, all right? Cough it up. Okay, all right. So you don't want to immediately start thumping Tina on the back, okay? Because she's able to cough. So if she can cough it up, that's fine. You just want to encourage her, all right? But what she might do is, maybe it's at a restaurant and she's really embarrassed, and she might want to take herself off to the bathroom. You don't want her, that's fine if she wants to do that, but you don't want her to be alone. You want to go with her, because maybe when she's in the bathroom, that mild obstruction might suddenly become severe. She could collapse and we wouldn't know about it. So you need to make sure you follow her, all right? So if it's a friend of yours, she's the same sex, because you can't go into the male bathroom, of course, you want to make sure that they're okay. However, if it's a severe obstruction, it's really scary, because they can't breathe, right? They can't get any breath, air into their lungs. That's the word, air. Couldn't think for a minute. They can't get any air into their lungs. They look frightened. They're very silent. They're not coughing, right? And the universal sign is putting the hands up to the neck like this, all right? So I want you to act that out. No coughing, no speaking. Very silent, looking scared, and put your hands up to your throat. Oh my gosh, Tina, are you choking? Are you choking? Okay, may I help you? All right, I know what to do. Okay, so you want to ask your casualty if you can help them. All right, ask their permission, get their consent, right? If you can help and you know what to do. So I'm going to stand slightly behind her and put one foot in between her legs. The reason I'm going to do that is because if I can't get that out, she's going to collapse and become unconscious. I can use my thigh muscles to gradually lower her to the floor and then start CPR. So I'm going to put one foot here, and then I'm going to support her around the middle, and I'm going to bend her over because I want that object to come down and onto the floor. Then between her shoulder blades, I'm going to take the heel of my hand and I'm going to give her up to 5 back blows. So, and I would do it hard, but I'm not really going to do it hard, okay? So it will be 1, did it come out? No, 2, 3, 4, 5, all right? Now, how hard I would hit would be dependent on the stature of that person. So Tina's quite slight, so I would hit her medium hard. If it was a big burly guy, I'm going to hit him really hard. If it was a child, it would be a little bit less, and I'd probably have to get down on my knee and put the child over my knee and then hit them on the back, okay? So, it didn't come out, so now I need to do abdominal thrusts. Now, to do abdominal thrusts, you need to make a fist with one hand, okay? And then I like to stick out my pinky finger and put my pinky finger in the navel. So, because I need to go between the navel and the breastbone. The breastbone was where we were doing our chest compression. So it's got to be in between. So, where's your navel? Here? About there? Is that your navel? Okay. And then I'm going to roll up like that. I'm going to bring the other hand around and cup it. And then I'm not really going to do it, but I would be going in and up. And I'd be doing it hard. And in and up 2, in and up 3, in and up 4, in and up 5, or if it came out. Still doesn't come out, back to the back blows. How many? 5. Yes, 1, 2, 3, 4, 5. And I would just, so I would keep alternating, all right? 5 back blows, 5 abdominal thrusts, 5 back blows, 5 abdominal until it comes out. Now, if it was a pregnant lady, so let's pretend you're a pregnant lady, Tina. I would be able to do the abdominal thrusts, all right? Because the baby's going to be there. So I would have to do chest thrusts instead. So you sit them down, you bend them over, support them, do the back blows the same, but instead of doing abdominal thrusts, you're going to go make your fist and center the chest where we were doing our chest compressions, and then you're just going to go in, 2, 3, 4, 5. Okay? Yeah, right where remember where we were doing our chest compressions? Yes. There. Right in the middle, and then you're just pressing in, okay? And you would also do that if it was somebody that was really obese and you couldn't get your arms around them. Or maybe they were really tall and you're really petite and you can't do the back blows, okay? Thank you so much, Tina. All right, so what I want everybody to do